Welcome to this webinar. My name is Stephanie, and today's topic is about workplace correspondence and documentation. Workplace correspondence refers to documents in the form of letters or emails. These are used to exchange information or to respond to relevant people. On the other hand, documentation refers to the process of recording events or issues in the workplace to provide proof or evidence. Both workplace correspondence and documentation must be completed. This will benefit the service by having authentic and transparent records about the clients and the events that happened within or outside of the service. So completing documentation according to legal requirements and organisation procedures. So legal requirements may refer to laws and legislations that services must adhere to. Organisational procedures, on the other hand, provide guidelines for decision-making within the service. These guidelines are designed by the service based on the legislation. It is essential to adhere to these legal requirements and organisational procedures. All relevant people within health or community services must conform to such requirements. It helps in building the credibility and reliability of the service. It also serves as protection for both clients and service workers for the safety and security of their information. Completing documentation according to the legal requirement. Documentation involves capturing important day-to-day occurrences in the service. For health and community services, documentation is focused on the client's information and their health and safety. Any medical treatment or other medical services given to or performed on the patient by the medical practitioner, such as the sufficient information to identify the patient, the information about the medical practitioner who provides the medical treatment, the clinical opinion reached by the medical practitioner, the treatment plan for the patient, the prescribed medications for the patient, and the advice given to the patient concerning any medical treatment. So based on the structure of your service, documented information may include the date of the treatment, the nature of the treatment, the name of the person who gave or performed the treatment, the type of anaesthetic, if any, given to the patient, the tissues, if any, sent to pathology, the results of findings made concerning the patient, any written consent given by a patient to medical treatment or other medical service proposed by the medical practitioner who treats the patient must be kept as part of the record relating to that patient. In general, the level of detail in a record must be appropriate to the patient's case and the medical practice concerned. A record must include sufficient information concerning the patient's case to allow another medical practitioner to continue management of the patient's care. All entries in the record must be accurate statements of fact or statements of clinical judgment. So completing documentation according to organisation procedures, regardless of the type of document, you must ensure that they meet the organisational procedures. Some things to consider when completing documentation is maintaining the documentation of healthcare records following policy requirements, ensuring that the client's information included in the record is accurate and up to date. Identification of a client must be seen on every page. This may involve their unique identifier, their full name, date of birth, and sex. All dates of entry must be included. Always use black or blue ink. Avoid using whiteout in handwritten documents. Instead, draw a line over the error and affix a date and your signature. Use understandable language. The information must be presented in a logical order. Draw a line for any unused spaces. This makes sure that no one can add anything to it. Write neatly and legibly. Use quotation marks when recording a client's statement. Do not complete documentation on behalf of another person. Any significant change in the client's physical, emotional, behavioural, and environmental condition must be immediately conveyed to the supervisor. Results of pathology, radiology, and other tests ordered must be included in the documentation. All incidents must be documented in their healthcare record. Any records of complaints must not be included in the patient's healthcare record. So read and clarify related workplace documents. Workplace documents are files or records pertinent to your role as a health or community service worker. This may involve different documents such as letters, contracts, and other documents relating to the service. Some documents may not be too straightforward. It is crucial to clarify your understanding with the supervisor to have explicit knowledge of the document before carrying out the task. So reading role-related workplace documents, one of the jobs is to communicate with relevant people. Below are some of the most common workplace documents in health and community services. So letters, contracts, inquiries, client records, client feedback, and reports. Clarifying understanding with your supervisor. All service members need to understand written text before doing a job. These are used as bases for decision-making and problem-solving. To ensure that your understanding is correct, you must clarify it with your supervisor. They are the ones who can confirm if your comprehension is accurate. They can also explain further if there are certain matters that you need to know in addition to what you have read. So some things to consider are approaching your supervisor, stating the concern, describing your understanding, letting them analyse, take note of additional details, and listen to their response. Complete workplace documents according to the organisation standards. Completing written and electronic workplace documents are essential in health and community services. These services are required to comply with the clinical and legislative standards, which include documentation standards. These records serve as evidence that may be used for different purposes within the service. Aside from reading workplace documents, one of your roles is to complete written and electronic workplace documents. The workplace documents that you will be writing are something similar to the documents that you are reading. Some workplace documents that you will be completing include letters, digital responses, client records, and reports. So below are some of the standards in completing documentation of any kind. So completeness. Documents must contain the necessary details, such as accurate date and time, correct spelling of names, list of tasks performed, and observations of the client. Consistency. Workplace documents must be coherent with a service's vision and mission. There must be consistent forms and templates to be used for each document. When maintaining consistency, think of the constant use of industry terminologies. The care plan must contain the procedures for service provision. Documentation must align with workplace policies. Legibility. Workplace documents must be readable to anyone who will be reading them. Things to consider for the documents to be legible are: your handwriting must be legible, the text on the document must be written using black or blue ink, use block letters instead of cursive ones. For electronic documents, stick to the format provided. Avoid changing font styles and colours. Accuracy. This means that details contained in the documentation must be authentic. This helps in keeping reliable documents that may be used for other purposes. Some of the things to consider for documentation to be accurate are: all the spellings must be correct, numbers must be written accurately, record the facts and not your opinions, don't embellish, quote the client's exact words. Timeliness. This means accomplishing the necessary documents as soon as they are needed. Some of the things to consider to complete your documents promptly is making sure that of the proper time format according to your workplace policies. Record the exact start and end time. Write crucial information immediately, example vital signs, dictated phone numbers, etc. Accomplish and submit records as soon as they are needed. So follow communication policies and procedures for using digital media. You'll be communicating with clients and other relevant people using digital media. This involves the use of mobile phones, the internet, email, and even social media. You must be knowledgeable about the communication policies and procedures when using digital media. Compliance with organisation policies and procedures ensures that the client's service members and other relevant people are safe and that their information is confidential. Internet and email policies and procedures. This policy outlines the internet and email protocols when communicating with clients and other relevant people. It is used as a guide to advise service members when using the internet and their email when exchanging information with people. The use of internet email must not affect the duties of the service and its service members, interfere with the operation of the service, compromise the security of documents being used in the service, breach any standards and legal or ethical requirements, compromise any confidentiality requirements of the service. Internet and email must not be used for creating or exchanging messages that are offensive, insulting, indecent, or threatening, providing any sensitive or confidential information kept by the service, generating, holding, or delivering information that violates copyright laws, generating or exchanging advertisements, solicitations, and other unsolicited emails. Mobile phone policy and procedures. This policy outlines the protocols for using mobile phones when communicating with clients and other relevant people. It is used as a guide to provide advice for service members when using mobile phones when exchanging information with people. Some of the things that you must adhere to are the service may provide a mobile phone to allow contact with clients and other relevant people regarding the service. Service members who have been provided with a mobile phone with email and internet access must also comply with the internet and email policy. The device must not be used in any way that may damage the legitimate interests of the service and its partners and affiliates. The mobile phone should be kept on to attend to client concerns and queries. The voicemail setup must be activated to inform the caller if the service member is available. Voicemail must be set up to include details such as the greeting, name and person of the service member, and the service name. Social media policies and procedures. This policy outlines the protocols for using social media when communicating with clients and other relevant people. It is used as a guide to provide advice for service members when using their social media accounts. This may apply when they make public comments regarding the service. So avoid making comments that are unlawful, indecent, insulting, threatening, harassing, discriminatory, or hateful to your own work, the service, the clients, colleagues, and other members. Avoid making comments that are created on behalf of the service rather than a personal point of view. Extremely criticising the government or respective policies that the employee is no longer available to work professionally and efficiently. Unwarranted personal attacks that are connected with your employment. Clarify that any views expressed are your own and not those of the service. When considering making personal comments, employees should reflect if the documents could cause the service, clients, and other relevant people to lose confidence in their ability to work in a professional manner. The comments are consistent with how the community expects the service to run and perform. The comments lower the reputation of the service. The comments are lawful. Someone takes a screenshot of the comments, then circulates them. So document evidence using clear, accurate, and objective language. One of your roles as a health or community service worker is documenting events. This involves taking notes of the specific details for the event to be explained accurately. Documentation helps record positive experiences in the service. It is important to document events to have evidence. These documents will prove that you adhere to the practices, rules, and processes of the service. Documented events can be used as supporting documents when there is a need to keep track of updates about clients, maintain positive work practices, identify ideas for improvement, and come up with better ideas. Documenting events. When documenting events, take note of the necessary details. So the persons involved. This refers to the persons engaged in the event. This may include the clients, your colleagues, service members, or other relevant people. You may also indicate these people's names, positions, within the service and stands during the event. The date and time are one of the things that legally bind a workplace document. They may help you protect yourself since you have the exact evidence which may be checked against other records, example, attendance records and CCTVs. Location. The location of where the event took place is as important as the date and time. Providing the exact spot helps verify the authenticity of the documentation. Observation. When documenting events, you must include your observation. Write in detail what both parties did. You may also have sensitive information which you may think may help for further investigation. Possible cause. When observing, you will also have an idea or assumption of the occurrence's possible reasons. While it is important to verify before writing them down, there are instances when the causes are apparent. Clear. The clarity of details is essential when documenting events. The documentation is clear if it is understood by the relevant people who will be reading it. For the documentation to be clear, it must contain specific information about the event. The details are arranged in a manner that are easy to follow. There's a time frame on when and how the event took place. Industry terminologies are used consistently. Accuracy. All details in the documentation must be accurate. This means that you must verify if the details you have written are valid, especially when it involves people's information. Spelling and grammar are correct. Proper format and writing conventions are followed. The exact date and location of the event are written accordingly. Objective. Make sure that these events are documented objectively. This means that you must suspend your views, judgments, and opinions. The details that you must be writing when documenting events are based purely on observation. What have we learned? In this session, we have covered communicate effectively with people, collaborate with colleagues, address constraints to communication, report conflicts, and accomplish workplace correspondence and documentation. In the next webinar, we'll be talking about contributing to continuous improvement. From here, you need to go to your tutor's online learning portal and complete the assessment activities. Thank you for your time today. I hope you found the session informative. Welcome to this webinar. My name is Stephanie, and today's topic is about contributing to continuous improvement. Workplace culture is defined by the shared values and principles, behaviour and interactions of the people in the service. When a service promotes a culture that encourages learning and trying new things, it promotes an environment that fosters innovation and continuous improvements. To contribute to continuous improvement, it is necessary to promote the value of creativity, innovation, and sustainability, and recognise successes in the workplace. So identify and voice improvements in work practices. Some of the improvements you may notice include increased client satisfaction, enhanced communication, improved collaboration, increased productivity, decreased conflicts. Voicing improvements in the workplace. Some of the ways on how improvements in work practices may be voiced include director speaking. This refers to speaking out about your concerns and suggestions for improvements. In this channel, you may be speaking directly to appropriate people. Representatives voicing work practices improvements may also be made through a representative. If you are in one team, your thoughts and opinions are collected by a team leader. They are the ones who act as a representative in voicing the views of the team. Surveys and feedbacks. Improvements may also be voiced out through surveys and feedback. Service members are given the autonomy to say what they want concerning enhancements they observe. Promoting and model improved work practices and procedures in accordance with organisation requirements. So after identifying and voicing improvements in work practices, you must promote and model the changes. Promoting means supporting and encouraging other members of the service to do the same. Modelling means acting out the needed behaviours to display improvements in the work practices consistently. You must ensure that these actions are according to the organisation requirements. Organisation requirements may refer to the service's vision, mission, objectives, and plans. These are also external requirements, such as legislation and standards that the service needs to adhere to. This ensures that the actions and behaviours you will be exhibiting are in line with what the service is expecting. So, most organisations have specific requirements that explain how it plans to progress for the future. These include a vision. This refers to what the service wants to achieve or to become. The main goal of a service mission is to build a strong identity and be known in the industry. Generally, the vision of health and community services is to become the most reliable and trusted care and service provider. The mission. This refers to the specific actions that should be done to achieve the service's vision. This may involve what the service needs to fulfill. For health and community services, this may refer to the services offered to the clients and relevant people. This involves how each of them will benefit from the service. Objectives. These refer to statements that describe the desired outcomes of the service. These objectives must be specific, measurable, achievable, relevant, and time-bound. A service may have a single overall objective or multiple objectives that should be attained together. Plans. This may refer to different plans within the service, one of which is a strategic plan. A strategic plan is a document used to communicate the service's goals to its members. It contains the actions that each member needs to do to achieve the service's goals and objectives. So promoting and modelling changes to improve work practices and procedures must be based on organisational requirements. So workplace improvements can be seen through increased client satisfaction, enhanced communication, improved collaboration, increased productivity, and decreased conflicts. Seek feedback and advice from skills and knowledge development. Areas may refer to the range of support and performance while dealing with clients and other relevant people. These areas may refer to how you communicate with them, how you collaborate in the workplace, how you manage constraints and conflicts, your attitude in accomplishing workplace tasks. These areas must be identified to be aware of the skills and knowledge you need to enhance further. This will help improve and strengthen your skills and knowledge and benefit the people in the service. Having advanced skills and knowledge will help you perform at your best. Feedback refers to comments, views, and opinions that the relevant people will give. Advice, on the other hand, refers to the guidance or recommendation they will provide. Both feedback and advice are given based on how practical your skills and knowledge are. These are offered as basis for improvement for future purposes. Areas for skill development and knowledge. There are many different points to focus on while communicating and working in health or community services. These areas include communicating with people, collaborating with people, addressing conflicts, completing workplace documents, and providing service. Seeking feedback and advice from appropriate people. The most appropriate people to seek feedback from are those with whom you work directly. These involve the clients, your colleagues, and your supervisor. Gathering feedback and advice is perhaps the most critical part of the review process. The integrated opinions of relevant people provide several perspectives and provide better insight into your skills and knowledge development. It would be best to use basic research techniques to systemize feedback collection and analysis to gather information effectively. One technique is collecting data from clients through surveys. Surveys allow you to elicit information on close-ended and short answer questions, and select respondents, administer questionnaire, and wait for the analysed results. So seeking advice. You may also seek advice from your colleagues, supervisors, or from higher authorities. Your colleagues may have alternative methods or ways that are more effective in the workplace. On the other hand, your supervisor and other higher authorities are more experienced in the working in health or community services. So below are the steps on how to seek advice from your colleagues, supervisors, or higher authorities. So start by asking for their availability, being respectful of their time. Let them know your concern. Be direct and to the point and let them know your situation. Make sure you prepare for the conversation. Prepare the questions, statements that you need to ask. Be aware of gestures and the way you talk to them. Ask them for advice, tips in developing your skills and knowledge. Listen to their thoughts, ideas, and beliefs, and reflect on how you can enhance our skills and knowledge. Be grateful and appreciate their time and effort. Do not forget to thank them for their time and effort. Consulting a manager regarding development opportunities. Upon seeking feedback and advice from appropriate people, you will know the areas that you need to improve. This may include your knowledge and skills in certain aspects of your job. It is now time for you to explore options for assessing skill development opportunities. Having the chance to access such opportunities will not just help you develop your skills, will also benefit from this as you will gain additional knowledge relating to your job. It is essential to consult with your manager regarding these options. They can as well offer support where you and the service can benefit from. After consulting your manager regarding the options for assessing skill development opportunities, it is your job to initiate action. You must take the necessary steps to gain new knowledge and skills to help you become better in your role. Options are training. This refers to undertaking sets of exercises and instruction to develop or enhance particular skills. Skills are further developed through practice and by following given instructions. Mentoring. This option is focused on having a mentor and you acting as a mentee. The mentor provides support and advice that you need to know in developing the necessary skills. Together with the mentor, you will be setting goals that you need to meet after the mentoring program. Continuing education. This refers to additional formal learning to attain a higher degree of education. This also involves taking a qualification relevant to health and communication services. Seminars, webinars. Attending seminars or webinars may also be an option in developing skills. Seminars refer to small group discussions, sessions discussing different topics. Webinars are like seminars, but in an online form. Membership in organisations. This refers to joining professional organisations or voluntary associations relating to health and community services. This helps in giving you different ideas on how others do it in the workplace. Each health and community services sector has particular organisations. So consulting with your manager. Options for accessing skill development opportunities must be consulted with your manager. Aside from the fact that they are more experienced with these matters, they may also help you decide which option is the best for you. They may also give suggestions that will provide you with clarifications on how to choose. So an example of the consultation process is entry. Refers to the introduction of the purpose of your consultation, where you mention your concern regarding the options for accessing skill development opportunities. Diagnosis, where the manager analyses your concerns and considers specific opportunities based on the expectations that you have given. Feedback, upon thinking of the possibilities and options, your manager then provides you with a variety of options that you may choose from. Implementation. This phase is where a decision will be made. You'll be informing the manager on which option you prefer, the most based on its capability in helping you develop the necessary skills. Closure. This phase begins with the evaluation of the primary concern. This is where you assess if there is a need to extend the process. Once the implementation is successful, the consultation can be closed. So initiating actions. You must initiate action for your skills to develop fully. You must take the necessary steps depending on your choice among the options provided. So, assessing your skills, the first step is identifying the areas for skill development. Then do your own research. After assessing and choosing a particular skill, do your research and explore different services or organisations that offer such a type of skill development. Consider your manager's advice. Aside from your own choice, you may also consider your manager's advice during the consultation. Choose from among the options. After considering your research and your manager's advice, it is now time for you to decide and to analyse which options will be the most effective considering your time and resources. Inquire about your choice. After deciding, inquire about the option that you have chosen. Involve yourself. Finally, involve yourself in the process. Make extra time for attending the sessions or conferences that you require. What have we learned? Now that you have completed this presentation, you should be able to communicate effectively with people, collaborate with colleagues, address constraints to communication, report conflicts, accomplish workplace correspondence and documentation, contribute to continuous improvement. From here, you need to go to your tutor's online learning portal to complete the assessment activities, the knowledge assessment questions relevant to this, and the skills assessment. Thank you for your time. I wish you well with the completion of your assessment task and hope you have found the webinars informative. Thank you.